Whiplash and concussion injuries happen at the same time in literally 100% of the cases. Of concussion will also cause a whiplash. Concussion requires an extensive amount of force. 70 to 120 Gs of acceleration is required to cause a concussion injury. For a whiplash injury, you only need 4.5 Gs. So literally every single concussion that is experienced also has an element of neck injury involved. And the symptoms of neck injury and the symptoms of concussion are identical. They are the same. So if you're having headaches and dizziness and visual problems and concentration problems and fogginess and all these things that you think are related to a brain injury, it could be the neck injury. So the best thing for this is manual therapy, getting treatment on the muscles and joints of your neck that are tight. Soft tissue therapy, acupuncture, and most of all, which I find to be very, very effective, which a lot of people are scared of, is neck manipulation, getting your neck adjusted. A good chiropractor can change your symptoms very, very quickly, right? Within one session, oftentimes with my patients, they walk out of there and they're like, whoa, like clear, everything is now like congruent and I feel like really, really good, right? It won't last, things will come back and you'll need to do this a few times in order to get the benefit of it. What can you do on your own if you don't have somebody near you? Well, range of motion exercises. So one thing that I often give patients is just look at yourself in a mirror and turn your head slowly side to side. Keep your eyes focused on yourself and just turn your eyes or turn your head side to side, back and forth, nice and slow. Because what you're doing is a couple things. One, you're working on the cervical ocular reflex, which is how your neck involves your eye motion. So your neck influences how your eyes move. So a lot of times people will feel that they have an eye problem and it's actually a neck problem, but it's been misdiagnosed. So they're going through all this eye vision rehab stuff and it's actually just a neck issue. So it'll work on that reflex, but also it will improve your range of motion exercises and it'll get your head and brain used to that type of motion. The other thing you can do is neck strengthening exercises. And this is usually done isometrically, which is a little bit difficult to explain, but it's things like deep neck flexor exercises. You can also do stretching and stuff. Again, a lot of this stuff should be guided by a rehab professional because they'll give you the right tools to do. But things you can do on your own, just kind of nice stretching and just range of motion exercises, rotation up and down, side to side, working on that ocular reflex. Just look at yourself in a mirror and do it, right? I feel kind of dizzy doing that. I need neck treatment. That's what I need.